My name is Michelle Snyders, and I'm the Hospice and Palliative Care Program Manager for SDAHO. I'm speaking in support of Senate Bill 147. This bill contains two important components for increasing access to palliative care for South Dakotans living with serious illness. First, the definition of palliative care, and second, the provision of education through the Department of Health's website. The definition provides a description of the medical subspecialty called palliative care. It differentiates it from hospice care, with which it is often confused. It does this by defining what palliative care is and who can receive it. It defines the scope of care to be provided and the locations where it can be provided. And finally, it defines who can provide palliative care. Having palliative care defined in regulation and statute enables a set of reimbursable services for third-party payers, not only for providers who are currently the only ones able to get reimbursed, but also the entire specially trained interdisciplinary team, nursing, social work, and chaplaincy. The Center to Advance Palliative Care and the National Academy for State Health Policy both identify that access to palliative care services is limited by reimbursement for the interdisciplinary team, in addition to a lack of professional and public education on palliative care and sufficient qualified healthcare professionals. With palliative care defined, the next step is a statewide education for South Dakota healthcare professionals and the public. This will provide a consistent, accurate message about palliative care. The biggest misconception for healthcare professionals and the public alike is that palliative care is synonymous with hospice care. Referrals to palliative care do not happen because providers believe that patients must be close to death and must give up treatment to receive palliative care. Patients are hesitant to accept palliative care for the same reasons. Making education available will not only help dispel this myth, but it will also allow for education on the benefits of palliative care. I'd like to share with you what specially trained palliative care looks like and its difference from hospice. In addition to being the program manager for SDAHO, I am also a specially trained palliative care social worker. I was part of an interdisciplinary team that provided physical, emotional, psychosocial, and spiritual care to people living with serious illness. To call myself specially trained, I hold a postmaster's palliative care certificate from the California State University Shirley Haynes Institute for Palliative Care. I'm credentialed through the Hospice and Palliative Credentialing Center as an advanced palliative and hospice social worker certified after passing a national exam. To keep my credentials, every 4 years, I must obtain 60 hours in hospice and palliative care education and/or in scholarly accomplishments, in addition to maintaining my clinical social work license. All this education and training, and yet there's no reimbursement for my time. I am also a palliative care patient. I live with multiple sclerosis. While I will not die from it, I will die with it. And since my diagnosis 6 years ago, I have experienced increased symptom burden, a negative impact on my quality of life, emotional challenges, employment issues, caregiver stress, complicated treatment options, an overwhelming array of medical stuff. Because this is not a terminal diagnosis, most people would not think of me as needing palliative care, but I knew better. I referred myself. The team I previously worked with is now my team working with me. The physician coordinates my care with my neurologist, treats my symptoms, and writes prescriptions for medical equipment that allows me to remain as independent as possible. The nurse monitors me after any change in medication and helps coordinate care with a plethora of other specialists I work with. The social worker helps me get practical things like FMLA, short-term disability when needed, and access to a handicap parking permit, along with making sure I'm coping with the emotional side of living with a serious illness. The palliative care team and my family have had advanced care planning discussions and updated advanced directives. The palliative care team made sure these were uploaded into my medical record. What I receive is not hospice care, it is palliative care. I'm not dying. I continue to receive aggressive treatment for my disease and participate in physical therapy. I work full-time, I stay active with my family, friends, and faith community. With the passage of Senate Bill 147, we can make sure that South Dakota healthcare professionals and patients fully understand the definition of palliative care and receive a consistent, accurate message about who is eligible for and the benefits of palliative care. Improving reimbursement opportunities for the entire specially trained interdisciplinary team anywhere a patient receives care will allow for growth of palliative care services across our state, making the specialty care more accessible to South Dakotans living with serious illness. I ask that you pass Senate Bill 147. Thank you for your time, and I'll stand by for questions.